Good morning. I'm Eric Peden from the Vascular Surgery Division, for those of you I don't work with on a daily basis. So MAHAM RAHIMI is our newest partner here at Houston Methodist Hospital in the Vascular Surgery Division. He's originally Persian and came here for his higher education, went to Dallas at SMU for his undergraduate degree, and then a combined program, UT Southwestern, UT Arlington in biomedical engineering, medical school in Lubbock, then at Texas Tech, with his last year in New York, and then now his integrated vascular surgery program at University of Cincinnati, where we have good friends and colleagues. So he's actually our first integrated vascular surgery resident to join us as faculty position here, and that's great to us because we've just started and graduated just our first integrated resident last year. He's going to talk to us this morning about nanotechnology, which he's been intensely involved in, has done a lot of research, has publications, and holds several patents on that. So thank you, and join me in welcoming Dr. Rahimi. Thanks.
Good morning. Thank you for giving me the opportunity to speak with you today. And thanks for Dr. Peden for the introduction. The title of my talk is Nanotechnology for Cardiovascular Applications. How many people here actually have done research in nanotechnology, nanomedicine? Excellent. I'm hoping that I start with introduction, introduce you what nanotechnology is, what nanomedicine is, and give you examples of how that could apply to cardiovascular system. This is a picture of Dr. Michael DeBakey showing him showing a Dacron graph on this picture here. Is basically what I'm trying to tell you here is using the clinical experience you have, you identify the challenges in medicine, use creativity, innovation, and new technology to move forward in the medical field and hopefully solve those challenges and problems. And in here, I try to tell you about nanotechnology and how perhaps you can apply it in your field. In order to introduce nanotechnology to you, let me tell you about my background that would give you some insight as what nanotechnology is. I started doing research in medicinal chemistry. I spent about 2 years to design a chemotherapy. And what we did was we used a computer program to look at the active side of an enzyme that was involved in cancer, and we tried to design an appropriate drug for it using computer program. Then we went to the laboratory, and I spent, again, 2 years to develop that drug, synthesize it using chemistry. Yeah, very effective in vitro. However, when we inject the mice, it was lethal, and the mice died. And now here I am, 2 years designing this drug, very effective in vitro, but now it doesn't have any application in the real world because it's very lethal. So I start searching, how can I deliver a toxic drug to only a cancer cell, only a specific side of the body? And that's where nanotechnology comes in. Nanotechnology is basically a small world that you use a particle to deliver drugs. So you can think of a nanotechnology in the simplest form as a drug delivery system. This is a picture of a syringe on the left, a solution in it. Inside the solution there are nanoparticles. I made it bigger so you can see on the left side there is a nanoparticle with a ligand, a protein around it. That protein is specifically attached to, for instance, cancer cell, or you can attach it to an inflamed endothelial cell for atherosclerotic disease. And then you can add drug inside these nanoparticles, and you can deliver whatever drug that you can imagine to the specific site disease process that you're working on. Nanostructure display a unique chemical, mechanical, electrical, and optical properties. As Richard Feynman said, there's plenty of room at the bottom. At the molecular level, you'll be able to change the direction of biological system by manipulating, again, at the molecular level. So it's a very powerful tool. Outline of my talk, first introduction of nanoparticle, giving you example of them, how we can apply it to vascular stent, vascular graft, tissue engineering, and then I'll touch up a little bit about the macro electromechanical system, MEMS. Again, nanoparticle can be used as a drug delivery system. A bacteria is in the size of 10,000 to 1,000 nanometer, virus in the size of 100 nanometer. And the range that we are usually work with nanoparticle is 100 to 500 nanometer for effective delivery. It could be in the form of liposome with the empty core here or a solid form. So it could be in any shape depending on the design and disease process you're trying to attack. And you can code these nanoparticles for a better improvement of the biocompatibility. Some definition here: nanoparticle, solid colloidal particle 10 to 1,000 nanometer. Nanocapsule, it has an empty core, it's just a shell. A nanosphere is a solid core, and a nanotechnology is basically using these for application in medicine, using design, synthesis, and characterization. In design of nanoparticle, you have to keep in mind the has to have a long half-life and immunocompatible. You can make it multifunctional, so at the same time that you can do your imaging for diagnosis, you can at the same time make them to be as a treatment to release therapeutic drug. And the important release profile of them is that it's not a burst release. When you give a PO or IV drug, you have a burst release of it. But in the nanoparticle, as the particle degrades or as particle release these drugs, it have a sustained release over time. And after it finishes its diagnosis, treatment, it would be biodegradable and goes away through the liver or kidney. In design of nanoparticle, you basically, as a clinician, find the challenges in your work daily, what does not work, and think about how you can apply this technology and use, again, creativity, innovation, referring back to Dr. DeBakey's picture, using a Dacron graph as a vascular graph. And then after designing for your clinical problem, you start synthesizing these nanoparticles using chemistry. And in order to make you understand how easily this could be done, imagine putting a few drops of oil in a water, and then you stir the water very quickly. Those droplets of oil becomes very small, depending how fast you go, becomes in a nano size. And now you got a nanoreactor. Now you can do all of your reaction inside that a small droplets of oil in the nanometer size. And that's as basic as it is, that how you make a nanoparticle. And then you can do fancy chemistry to code them to make it biocompatible, attach protein to specifically attach a disease process you're working with. After synthesis, you will characterize these nanoparticles. Since you can't see them with the naked eye, you can use electron microscope, atomic force microscope, Fourier transfer, IR, and spectroscopy is one of the most common characterization method that we use in nanotechnology. From here on, I'm going to give you examples of how you can apply nanotechnology, that you have a basic understanding of what nanotechnology is. How can you apply this in the clinical world? This is an example of acute thrombosis. Somebody comes with a stroke. The first image you want to do is a CT scan to see if it's hemorrhagic or not, but you cannot give contrast. What if you can do your diagnosis and treatment of acute thrombus at the same time? So in this picture, you can see a gold nanoparticle accumulating inside the blood vessel, and you can easily see it in the CT scan. So this is an example of diagnosing using nanoparticle. Now, what if you add not only diagnosis, also therapeutic to these nanoparticles? This is an example of what Houston Methodist has done with Paulo de Cozo, releasing TPA. And what this is that a magnetic particle in a center Now, you ask, why would you need magnetic particle? In order to deliver them at a specific site. So imagine injecting these nanoparticles through the IV and then localizing them using external magnetic field anywhere in the body that you want. And imagine at the next time you can apply alternative magnetic field, cause these nanoparticles undergo something called Brownian motion, which induce heat. Some of these shells that you can see over here are temperature sensitive and they can release the drug. Or TPA, as some of you might know, works better at a higher temperature. So we use a nanotechnology here as a diagnosis. You can deliver it at the site that you want, and then you can release the drug that you need. And it has a higher bioavailability, a decreased hemorrhagic risk, because TBA is not without a risk. And also, it's a diagnostic method using MRI contrast agent because of the magnetic nanoparticle in the center. This is an example of a patient with mechanical heart valve placement. You have to put these patients on anticoagulation, lifelong anticoagulation. What if you can inject the heart around this heart valve in order to release TPA over time, rather than subjecting the patient for a long time systemic anticoagulation versus giving them local anticoagulation. So in this picture, you can see a heart valve with a clot on it that was not treated. And this is a heart valve with treatment that you cannot see any clot in it. Now, what these are is basically a chitosan polysaccharide nanoparticle that have a TPA gene plasmid, and you transfect the cardiocytes, make them to release TPA only around the valve by injecting them during the surgery. Other nanoparticles have been used for acute thrombus. You can use any polymers depending on your application. You can use polylactic acid, polyglycolic acid, and you can even combine the both to get the right ratio in order to have an appropriate release as how fast they get degraded. You can have gelatin, zinc acetate, and other particles. Dr. Tessiotti in the Houston Methodist has also been working on nanotechnology, and he developed a strategy to affect the inflamed vasculature. He basically used a proteolipid vesicle as to target the inflamed endothelial cells. The idea behind this is that these particles are not all of them biocompatible. They have side effects. I will go through the limitation at the end. But what smart strategy he used here was using a strategy, something called nano-ghost. And what that is basically using the own patient's blood in order to make your nanoparticles, so the body cannot recognize these nanoparticles, and you can have the same effect as I described for diagnostic and therapeutic. With his research has shown that you can developed these protein deliver from the leukocyte plasma membrane into a lipid nanoparticle and target inflamed vasculature to deliver dexamethasone. So application in atherosclerosis comes to mind. So you can use nanoparticle in regenerative medicine. Imagine a patient has a heart attack, myocardial infarction, and you have these nanoparticles made of polysaccharide, again, chitosan, and you have growth factor, and you inject these myocytes with these nanoparticles and release the growth factor. Well, their studies have shown in Journal of Nanomedicine in 2011 that you can increase the ejection fraction, decrease the scar, decrease inflammation, increase angiogenesis. This is an example how you can use nanotechnology in vascular graft. You can make not only a nanoparticle, but also you can make nanofibers. And you can make these nanofibers, for instance, an example over here, that you can recruit endothelial cells and induce angiogenesis. And this improved cardiac function, upregulated VEGF, and angiogenesis. Again, all of these are examples of challenges that we deal as a clinician every day. And I'm just giving you an example of how you can use nanotechnology in your clinical challenges daily. Another example of regenerative medicine, you can use a PLGA nanoparticle. You can incorporate growth factor in here. In journal Control released in 2013, they use insulin-like growth factor to put a statin, and this had a cardioprotective drug delivery system. Or you can even use the anti-free radical mechanism such as superoxide dismutase, and it showed that in 2009 in one of the publications indicated has increased ejection, the reduction of the infarct volume in stroke model in 60%. Another example of the regenerative medicine, you can use a different type of polymer to encapsulate siRNA, or with the endothelial specific recognition peptide to block inflammation or induce regeneration. Just ignore my picture in the background, but this is one of my research that I've done. You can use external magnetic field to localize these nanoparticles. So you can use external magnetic field to bring it to the disease site. You can image them using MRI, and these are the nanoparticles that I've designed with a core of magnetic and a shell of a gel around it. And what this shows is that you can deliver them to the specific site. You can use alternative magnetic field, causes again undergo Brownian motion, induce heat to the polymer around, and they shrink and release the drug at the specific location after delivery. These graphs indicating at different temperature you can have a different release. But again here showing a sustained release, not a burst release. But surely you can have a burst release if you apply alternative magnetic field at an alternative time in order to have that burst release that if you need it. Then I apply this to biodegradable magnetic stent. What if you treat a superficial femoral artery or coronary artery with a magnetic stent? You inject these nanoparticles. These nanoparticles get specifically trapped on these magnetic stent, and you can deliver different drug at different time to these stents. Anti-inflammatory drug, anti-proliferative, anti-thrombotic drug. This is an example of how you can use nanotechnology in vascular graft. And I'm going through the process of what we are capable of doing in nanotechnology. You can select the material that you want that is biodegradable, biocompatible, and then you can form the vascular graft that you need in this bottom picture here. You can put different drugs such as aspirin, statin, heparin, VEGF coated on these vascular graft. And also you can use tissue engineering to incorporate endothelial cells and even smooth muscle cells to produce vascular graft here. These are called intelligent biomaterials. This is another example of how you can use nanotechnology here, example of nanotubes. One of the problems with transcatheter aortic valve placement is delivery system. Delivery size is very big. What they've done in this research here, published this year, that they use carbon nanoparticle to reduce the delivery size of these transcatheter aortic valve placement. They had higher strength, better compatibility, lower delivery size. And the delivery size for people that don't do endovascular intervention is correlated to the complication that you see. So the larger the sheet size is, the more access complication you're going to have. Now, in the next few minutes, I'm going to conclude my talk by going from the world of nanotechnology to macrotechnology. This system is a macro electromechanical systems. And what this enables you to do to monitor the stent, the vascular stent, externally. So you can receive information from this stent externally and tells you how the stent is doing. Is the stent still patent? Is there progression of the disease? Is it the acute thrombus happened to this stent that you need to treat? And what it has is basically has these pressure sensors at the end of the stent here that senses the progression of disease, acute thrombus, and send a radio frequency signal outside the body. And the surgeon and the physician will know that there is trouble with this stent and can treat before it gets too late. This is another example of a micro ward. And again, this system called MEMS, stands for microelectromechanical system. What if you can apply the same thing to graft, vascular graft that we have available? What if you can get information about these grafts, not using ultrasound, but the real-life information over time? And you can see sensors that are built inside this graft with a coils that transmit this information from this graft, that how it's doing. Is it clotted? Is it disease progress? Is there anything needs to be done to intervene on these before it gets too late at the earliest stages? So again, you can use these technology at the nano scale or micro scale to help your challenges in the clinical world. The nanoparticle is not without limitations. The question is why we don't have it available in the clinic nowadays. I'm going to review a few problems with them, and there's a bright future, and I think we can overcome these limitations. The permeability is an issue. Although they are very small, they can go inside and outside the blood vessel. But there's a problem with the diffusion and the random path they take. Although the magnetic nanoparticle that I explained to you, you can deliver them at a specific site, but your control from outside the body on these nanoparticles is limited. It's not perfect. But there are research that's being done to make headways on the permeability. The other problem with nanotechnology is a problem with reproducibility and scale-up and mass production. Bioavailability is an issue. When body recognize these, try to eliminate them to the liver or kidney. So you have to find a way, such as what Dr. Testioka was doing in Methodist, in order to have the bioavailability, use these nanoghosts. You use the monocyte, platelet, red blood cell from the body, and make him in the nano size and try to make him to do the application of diagnosis and treatment at the nano level. And the body will not recognize it. And the big issue is safety. The big question is, what does these nanoparticles do when you inject them to human? But we are far from it yet, but there are a lot of good headways and a lot of good people are working on it. Again, why there's no progression in clinical trial? As I mentioned in the last slide, all of those limitations prevent the research to move forward. The small sample size, not a lot of patients want to go through these new technology and be treated with these new technologies, so the sample size are not high. The other difficulty is distinguish what failed the treatment. Is it the progression of the disease or these are the nanoparticles causing this system to fail? In summary, nanotechnology is a feasibility. It's a possibility that you can use in your clinical world, but you have to think about the limitation that I mentioned to evaluate its safety, its bioavailability, mass production. But the key things in here is that the collaboration between engineers and the physicians, it's essential. The physician knows what are the clinical challenges knows what the issues that he faces daily, and the engineer, with their experience, with their information in nanotechnology, can perhaps provide solution for those challenges and apply it to clinical practice. I want to thank you for giving me the opportunity to present to you, and by this I conclude my presentation.
Farley.
Thank you for that great overview. And I think you've identified certain key features which limit the translation into clinical practice. But in cardiovascular space, in your opinion, and I mean there are different challenges, the biocompatibility and the biology of the chemical nature of the particle is one, of course the route of delivery and therapeutics. But as far as the composition of the particle is concerned, which particle do you think if you take gene delivery as the vehicle, which particle do you think has the greatest or the closest feasibility of being in a state where it can be used in clinical practice?
Yes, sir. It's a $1 million question. I can tell you what's the new headway in technology is, and what Dr. Tassiosi is doing here in Methodist with a nanoghost. I think using the own macrosystem that are available in the body, red blood cell, platelet, monocyte, using these and taking it from the body and then reducing the size to the nanometer by breaking up by using the same shell as the system for a delivery, I think it has a lot of potential, a lot of solve a lot of limitation that I've discussed. So I think nanoghost is something that you're going to hear soon, and I think that's something that perhaps has very promising clinical application.
And just a quick follow-up: are there I know the cancer world probably is a little ahead in nanotherapeutics. Are there any approved therapies in nanotherapeutics in the cancer world and not in cardiovascular world, or it's still the same?
Still the same, but there is more, in my understanding, there is more headway in cancer, as you mentioned. But the interesting thing is how we can use that massive amount of information that we have obtained from cancer therapy and apply it to atherosclerosis, cardiovascular disease. To answer your question, I do not know of one.
Enjoyed your presentation. You talk about MRI to try to release whatever is coded on the nanoparticles. Has ultrasound, different frequencies, or have you been used to see whether you could do that at will, almost on the bedside, where you could increase vibration of these nanoparticles and release some of that at will?
Yes, sir, absolutely. Ultrasound is a very a special tool that you can use, but majority of the time that I've seen it's used, the problem with these nanoparticles is that they clump together when you inject it to the system. And in order to make them separated as a form of nanoparticle, again, I have seen it that you can use ultrasound in order to disperse them again. I have seen them that you could make models, animal models, but I have not encountered too many research as using external a stimulator of these nanoparticles. But although it will have a lot of application if people think that way.
So I think you did identify, and Dr. Bimraj brought it up also, the major problem in cardiovascular is delivery to the blood vessels, delivery to the heart. And I think there are different approaches. The leukosomes that you mentioned that Ennio Tassiotti has been working on, they do seem to home to areas of atherogenesis in hypercholesterolemic animals. Roman Sokovershan, working with Ennio, has done some work here. Then the other possibility is taking advantage of the alterations that occur at sites of vascular disease. So you have, for example, in the atherosclerotic plaque, you have a neovascularization that's very similar to tumor angiogenesis. And those vessels are tortuous and permeable. And Dr. Ferrari's methodology for delivering these MSVs, the silicon nanoparticles that have a affinity for permeable tumor vessels, could potentially be useful for atherosclerosis, for neovascularization. So I think there's a couple of potential nanoparticles that are being developed here that might be useful for cardiovascular disease. We have, by the way, we have a symposium coming up in October, the Costa Symposium. And please come, and everyone here should come because we'll talk a lot more about nanoparticles and their application to cardiovascular disease. The Costa Symposium. Look for it. It'll be coming in your emails.
Yes, sir. Thank you so much. It would be an honor. I will definitely be there.
John, I might just ask, is it strictly delivery, though, or is it the right drug that we're going to deliver? And the delivery mechanism probably changes which drug and how you'd want that drug to work, I would guess.
No, that's certainly a fair point. And I do believe, though, that the biggest hurdle currently is delivery. I think that we can address issues of biocompatibility. I think, we'll try different agents, of course. Find out what's most useful for whatever condition you're looking into. But I think delivery is still, that's the big one. Most nanoparticles end up in the liver, the reticular endothelial system, or the lung. So that's a problem.
Delivery meaning targeted delivery.
Yes.
Yeah. Dr. Noon, I might just ask, that picture of Dr. DeBakey, is that truly his wife's sewing machine, or is that some staged media thing for afterwards? That was the real thing. That's great. That's fantastic. All right, other questions we might take? Otherwise, then I think we'll probably finish a little early, and thanks to Dr. Rahimi for grand rounds this morning.